Today we will discuss about bronchiectasis. At first, what is bronchiectasis? Bronchiectasis means abnormal dilatation of the bronchi. Now the causes of bronchiectasis: congenital and acquired. Congenital bronchiectasis include cystic fibrosis, primary ciliary dyskinesia, and kartagener syndrome. Kartagener syndrome means sinusitis and transposition of the viscera. Acquired cause of bronchiectasis occurring in children: whooping cough, measles, and primary tuberculosis. An acquired cause of bronchiectasis in adult: pneumonia, pulmonary TB, and allergic bronchopulmonary aspergillosis. Now the clinical features of bronchiectasis: chronic cough, purulent sputum production, pleuritic chest pain, haemoptysis, halitosis, fever, anorexia, malaise, and weight loss. Now the investigations of bronchiectasis: complete blood count, sputum culture, and chest X-ray which shows collapse or consolidation. CT scan of the chest is more sensitive. Now the management plan of bronchiectasis: chest physiotherapy, antibiotics therapy, and surgical treatment. Chest physiotherapy, which includes patient should lie in position and take a deep breath and then forcefully expire the air, which helps the secretion move from bronchi to trachea. Then vigorous coughing. This done for 5 to 10 minutes twice a day. Antibiotics therapy, which include oral ciprofloxacin 500 mg twice daily, and surgical treatment, which include excision of the bronchiectatic area. And that's all about bronchiectasis. If you like this video, thumbs up the video and don't forget to subscribe this channel. Thanks for watching this video.